Another day, another video of first aid by heartburn during pregnancy, causes and treatment. Heartburn is a common symptom that many pregnant women experience during their pregnancy. Heartburn is a burning sensation in the chest and throat, which is caused by stomach acid rising up into the esophagus. This can be uncomfortable and unpleasant, but it is usually not harmful to the baby. In this video, we will explore the causes of heartburn during pregnancy and the various treatments that can be used to relieve it. Heartburn. What is it? Heartburn is a common condition in which the acidic contents of the stomach back up into the esophagus and cause a burning sensation in the chest. It is most commonly associated with pregnancy and can be quite uncomfortable. Fortunately, there are many treatments available to provide pregnancy heartburn relief. These include lifestyle changes such as avoiding certain foods, eating smaller meals more frequently, and avoiding lying down after eating. Over-the-counter medications like antacids and H2 receptor blockers can also provide relief. Finally, if the heartburn persists, a doctor may prescribe stronger medications. With the right treatment, pregnant women can get the relief they need from heartburn. Why do women get heartburn during pregnancy? Pregnancy heartburn is a common discomfort for many pregnant women. During pregnancy, the levels of hormones that relax the muscles in the body, including the digestive tract, increase. This relaxation can cause stomach acid to leak back up into the esophagus, leading to heartburn. Additionally, the growing baby puts pressure on the stomach, which can also push stomach acid up into the esophagus. To relieve pregnancy heartburn, pregnant women can try eating smaller meals more frequently, avoiding spicy and fatty foods, and sleeping with the head of the bed raised. Additionally, antacids and other medications can provide relief. However, women should always speak to a doctor before taking any medication during pregnancy. What does pregnancy acid reflux entail? Pregnancy acid reflux, or heartburn, is a common condition experienced by pregnant women. It is caused by the pressure of the growing fetus on the stomach, resulting in stomach acid being forced up into the esophagus. Symptoms of pregnancy acid reflux can include burning sensations in the chest or throat and difficulty swallowing. Many pregnant women seek relief from these symptoms by making dietary changes, such as avoiding acidic or spicy foods, and taking over-the-counter antacids. Other forms of relief can include elevating the head of the bed, resting after meals, and avoiding large meals late in the evening. If these measures do not provide adequate relief, pregnant women can also talk to their doctor about medications that are safe to use during pregnancy. What does pregnancy heartburn feel like? Pregnancy heartburn can be an uncomfortable and even painful experience for many expecting mothers. It is caused by the rising levels of hormones and the pressure of the growing baby, which can cause the stomach acid to travel up into the esophagus. Pregnancy heartburn can feel like burning pain in the chest, behind the breastbone, or in the throat. It is often accompanied by a sour or bitter taste in the mouth, and can worsen when lying down or after eating a meal. Thankfully, there are a variety of methods to find relief from pregnancy heartburn, such as taking antacids and avoiding certain trigger foods. Additionally, pregnant women can try sleeping with their head elevated, eating smaller meals more frequently, and drinking plenty of water to help reduce the symptoms. How common is heartburn during pregnancy? Heartburn is a common symptom during pregnancy, with up to 80% of women experiencing it at some point. Heartburn is caused by the increasing levels of hormones and the pressure of the growing baby on the stomach. It is often characterized by a burning sensation in the chest or throat, and can be accompanied by nausea, bloating, or difficulty swallowing. Fortunately, there are a number of ways to find relief from pregnancy heartburn. These include eating smaller meals more frequently, avoiding certain trigger foods, and sleeping in an elevated position. Over-the-counter antacids and other medications may also be used to help alleviate symptoms. Causes of heartburn during pregnancy. The main cause of heartburn during pregnancy is the hormone progesterone. Progesterone is produced in higher levels during pregnancy, and it relaxes the muscles in the body, including the muscles in the stomach and esophagus. When the muscles in the stomach relax, the acid from the stomach can flow back up into the esophagus, causing heartburn. Another cause of heartburn during pregnancy is the growing size of the uterus. As the uterus grows, it puts pressure on the stomach, which can force the acid up into the esophagus. This is more likely to happen later in pregnancy when the uterus is larger. Finally, some foods and drinks can trigger heartburn during pregnancy. Spicy, fatty, or acidic foods can irritate the stomach and cause heartburn. Additionally, drinking caffeine, alcohol, or carbonated drinks can also trigger heartburn. Treatment for heartburn during pregnancy. There are several treatments that can be used to relieve heartburn during pregnancy. These treatments include eating smaller, more frequent meals. Eating smaller, more frequent meals throughout the day is an effective way for pregnant women to manage heartburn. Eating multiple, smaller meals instead of 3 large ones helps to keep the stomach from becoming too full, which can exacerbate the symptoms of heartburn. Additionally, avoiding foods that are known to trigger heartburn, such as spicy, fatty, and acidic foods, can help to reduce the symptoms. In addition to diet modifications, pregnant women can also try drinking chamomile tea, which may provide relief from heartburn. Lastly, sleeping in a slightly elevated position can also help to relieve heartburn during pregnancy. Avoiding trigger foods and drinks. Eating a balanced diet and avoiding trigger foods and drinks can be a great way to manage heartburn during pregnancy. Trigger foods and drinks can vary from person to person, but common triggers include spicy foods, fried foods, citrus fruits, caffeine, and carbonated drinks. It's important to keep a food diary to identify any foods that may be causing heartburn. Once these foods are identified, it's best to avoid them as much as possible. Eating smaller meals at regular intervals throughout the day can also help to reduce the risk of heartburn. Additionally, it is important to stay hydrated and drink plenty of water throughout the day. Sleeping on an incline. Sleeping on an incline is one of the recommended treatments to help relieve heartburn during pregnancy. Sleeping with your upper body slightly elevated can help reduce the pressure on your stomach and make it harder for stomach acid to travel up the esophagus. This can help reduce the uncomfortable burning sensation associated with heartburn. It is best to place a few pillows under your head and shoulders to create an incline while you sleep. Additionally, you can use a wedge under your mattress to provide a more gradual incline. If you have any questions or concerns about using an incline to help with heartburn during your pregnancy, be sure to speak to your doctor. Taking antacids. Taking antacids is a common and safe treatment for heartburn during pregnancy. Antacids work by neutralizing stomach acid, thus reducing the burning sensation associated with heartburn. It is important to discuss any medications with your healthcare provider before taking them. It is also important to follow the dosage instructions, as taking too much antacid can lead to an electrolyte imbalance, which can be dangerous for pregnant women. While antacids are generally considered safe for use during pregnancy, it is best to avoid antacids that contain magnesium, as this can contribute to preterm labor or other complications. Trying natural remedies. Trying natural remedies for heartburn during pregnancy is becoming increasingly popular. Natural remedies can help to reduce the symptoms of heartburn without the use of medication. Some of the most common natural remedies include eating smaller, more frequent meals, avoiding spicy or acidic foods, eating slowly, and drinking plenty of water. Herbal teas such as chamomile and ginger can be beneficial as well. Eating smaller meals can help to reduce the amount of stomach acid that is produced, while avoiding spicy and acidic foods can help to reduce the amount of irritation to the esophagus. Eating slowly can also help to reduce the amount of acid that is produced. Drinking plenty of water can help to reduce the symptoms of heartburn by neutralizing the acid in the stomach. Herbal teas can also help to soothe the esophagus and reduce inflammation. Natural remedies can provide relief from the symptoms of heartburn during pregnancy while avoiding the use of over-the-counter medications. In conclusion, heartburn is a common symptom that many pregnant women experience during their pregnancy. It is caused by the hormone progesterone, the growing size of the uterus, and certain foods and drinks. There are several treatments that can be used to relieve heartburn during pregnancy, including eating smaller, more frequent meals, avoiding trigger foods and drinks, sleeping on an incline, taking antacids, and trying natural remedies. Pregnant women who experience heartburn should talk to their healthcare provider to determine the best course of treatment. Thanks for watching.